It's 11:11. Make a wish.
Hi, it's Shelli, and this week's episode is pretty heavy, and when we recorded it, you could tell. And as I was editing it, I didn't want to edit out too much of the content because the content itself is extremely relevant and informative. But it evoked a reaction in all of us. And so, in that vein, what I've decided to do, because another thing that happened during this episode is Luna asked Tiffany and I to jump in with our thoughts or takes on what she was saying as far as why it's important to get diagnosed. And neither of us did. And one of the reasons I know that I didn't jump in was because of the way the script was written. And I didn't want to derail the important things that I knew were going to be said. And so I didn't say anything. But I have thoughts on this topic, and it's important that we discuss them. So what I'm going to do is, while I'm completing the final edits, after each point that Luna makes, and there are 11 of them, I am going to give a 1 minute or so reaction to that from my perspective about how having a diagnosis in advance would have helped whatever that bullet item was. And I'll give a quick example. Tiffany has done the same. And I have not watched any of Tiffany's videos that she sent me. I'm not going to watch them until I'm doing the final rendering of the video, just to keep my reactions authentic. Getting a diagnosis is a privilege. It shouldn't be. It shouldn't be. But it is. It's not accessible to everyone. And even if it's accessible, because there are ways that a regular doctor could use a diagnostic checklist and diagnose someone, a lot of doctors won't. And I don't have stats to back that up. I'm stating that strictly from anecdotal evidence, emails I get on social media, messages, etc. And some of it could also have a negative connotation. The very first episode of this podcast covered the Social Security Administration having a study done to determine the disabling effects of the inherited connective tissue disorders. So by getting diagnosed with a connective tissue disorder, if you hadn't thought you were disabled prior to, if you get diagnosed with this condition, maybe you will be a lucky one and you won't have a myriad of health problems like many of us face. But the truth is, you probably will. So there's the negative connotation of being disabled. There's the concern that the discrimination that comes with being disabled, the shame, and whether that's internal shame or external. This disability, for many of us, is dynamic in nature, and it's very hard to I struggle with this myself, honestly. I struggle to say with a straight face that I'm disabled. I know I am, but I can still do things sometimes. And so for whatever reason, all of the shame and programming and negative ideas of disability that have been instilled in me from all of the places still attaches shame to it. And then, when I decide to be proud about what I've achieved in spite of this meat suit, if people say, oh, you're disabled, then the defensiveness comes in. And so I think it'll be worthwhile for us to explore this topic a little bit further. And I also think that these same factors play a role in why many adults don't seek a formal autism diagnosis, which I have a formal diagnosis for that and ADHD. And, I've explained in other episodes the reasons why I chose to pursue that. I'm called to talk about everything that's going on with me. I always have been. I've never, ever been accused of giving someone not enough information. I am someone who, I'm a knowledge seeker, always have been. And so I always want all of the information available to me. And because of me being nosy and also having a myriad of issues going on with me, it seems like I've just gone through a bunch of stuff in my life, and I don't want other people to have to unnecessarily go through things that they don't have to. Whether you disclose it to anyone or not, it's important to know if you have connective tissue disorder. And I would even argue it's important to know your neurotype on top of that, because how you handle the care of your body when it comes to a connective tissue disorder, a lot of those same principles can be applied if you're neurodivergent also. And the reason why that is likely, and not just likely, but I would say true, at least in my case it's true, is because they're comorbid and they're related.
All right, let's get to part 1 of why you should get diagnosed.
Right. Welcome back to the Hacking Hypermobility podcast. This episode is our answer to one of the most common questions. Is it worth my time and, let's face it, money to get diagnosed with Ehlers-Danlos Syndrome?
Hi, hypermobile humans. Thank you for taking your time out of your day to listen or watch. Shelli, so many people ask me, it's probably the most common question I get, should I use my precious spoons to go through the frustration of seeking a diagnosis to understand my hypermobile condition? Today, we want to answer that both from a medical and personal standpoint, but even when people ask me, why should I get diagnosed with EDS? My first thought is the answer's in the question, because what if it isn't even EDS? And if so, well, which type of EDS? Because there are other disorders associated with hypermobility and these syndromes that cause hypermobility beyond EDS. And as we know, there's a growing list of subtypes of the Ehlers-Danlos syndromes.
Before we start, a quick disclaimer. The information provided in this podcast is for educational purposes only and should not be considered as medical advice. Please consult with healthcare professionals or personalized guidance on managing your health. Are we ready to get started, Luna?
Yeah, thanks, Tiffany. Let's get started. I think in this first section, I want to just kind of preface our discussion. Also, this episode has a warning that we will be discussing some sensitive topics regarding weight, traumatic death, child loss, and suicide. I'm not going to make you listen to the whole episode until I tell you why I think getting diagnosed is worth the effort. The number one reason, the overarching thought that I have is diagnosis empowers you to have a better quality of life, and you're worthy of that. So hypermobility, as we've discussed, is not just flexibility. It's not just joint problems. And in fact, many of us have major organs that are affected. And in fact, the reality of this condition is usually bigger than just you. Also, it's likely affecting more than one person in your family. And this can affect your quality of life and life expectancy. Pursuing the evaluation of hypermobility could lead to a diagnosis of things like the Ehlers-Danlos Syndromes, we call EDS, joint hypermobility syndrome, or another inherited connective tissue disorder. And a thorough evaluation and accurate diagnosis can be important for several reasons. It's essential to consult with a healthcare professional if you suspect you have EDS or HEDS to discuss your symptoms, undergo the proper evaluation, and receive guidance on diagnosis and management. And an early and accurate diagnosis related to your particular hypermobile condition is vital for both you as a patient and your medical team to chart the course for the best treatment, therapy, lifestyle changes, decision planning, and that sort of thing for your life.
The diagnostic process can be very frustrating. If you need support on the journey, we discussed it in detail back in season 1 in episode 2. Actually, episodes 2 through 6, and we'll link that in the show notes if you need to go back for a refresher. So in May, which was EDS Awareness Month, the EDS Society published this. It reads, quote, "The average time to diagnosis of an Ehlers-Danlos syndrome or hypermobility spectrum disorder is 10 to 12 years for some, and it can take decades for others. Early diagnosis is crucial to positive health." I said, quote, and I didn't quote this. That's fine. As these symptoms are multi-systemic, problems often go uncorrected for many years, and many report being told their symptoms are all in their head, or that they can't possibly be experiencing the pain that they're experiencing or other symptoms that they say they are. Misdiagnosis is common, delaying treatment or resulting in unnecessary surgeries and unsuitable treatment.
So the average time to diagnosis is a really good point to start off this discussion. Shelli, you have our list of reasons to get diagnosed. I'm going to have you read the reason for us, and I'll go through the details with each point. And as we talk, I want you and Tiffany to jump in with your thoughts or experiences just as we go.
Okay. All right. Well, first one is treatment strategy. So the appropriate diagnosis informs your medical treatment and management. What do you mean by that?
So a formal diagnosis, and the correct one, can help your healthcare professionals develop a targeted treatment plan for your hypermobile condition, including things like physical therapy, pain management strategies, and medications to improve your quality of life.
So with regard to this first one, if my doctors had known that I had hypermobile Ehlers-Danlos syndrome instead of the suspected ailments that they were treating me for, like rheumatoid arthritis, even though I never had any positive factors, I just had a handful of symptoms, it might have changed the way I had looked at the rest of what was going on with me, because we were so hyper focused on that it was this autoimmune thing that we kind of stopped looking in other directions.
I am still working on getting a treatment plan fine-tuned. Where I have noticed it's been so helpful was with occupational therapy. So my occupational therapist, we focus mostly on my hands because I have so many problems with my hands and have for years. So the nice thing was the occupational therapist
was very familiar with EDS, but had never had an EDS patient. So they were so excited when I came in for my evaluation and I explained why I was there. And you could just tell, like, she was lit up, and she was also like neurodivergent. And so she understood that side. So we had like a fantastic, I want to say it was probably one of the best medical appointments I've ever had. But she actually went and researched EDS specific protocols and treatments. And then while we were doing the OT, she would show me a typical range of motion, or how something is typically done, how I was doing it, and then how I can kind of be more aware of how I'm moving. Because I didn't realize a lot of the movements, like opening a jar, I would always sublux. And she's like, you're going way too far. You shouldn't, this is how far I can go. And that's typically like a good range. So you want to stop here instead of going all the way. And just those little things, just showing me where I didn't know, because how would you know? Showing me where those things are that weren't typical, and how I was stressing my joints, which without even knowing, that was incredibly helpful.
Okay, that makes sense. All right. The next thing you have is that it can prevent complications. The appropriate diagnosis prevents complications. How so?
So early diagnosis can help prevent or manage potential complications associated with these conditions, such as joint dislocations and eventual joint damage, chronic pain, and cardiovascular issues. You can avoid activities that might cause irreversible damage or unhelpful treatments. And appropriate and timely care can mitigate what we call medicalized trauma. Prevention of future injuries by choosing things like the type of athletics you do or hobbies can prevent damage. And your doctor might take some more specific targeted approaches with medications, surgical interventions, and treatments. But first, there are also some specific dangers to us. There are two important things that can be considered dangerous to those of us with hypermobile conditions. First is a type of antibiotic called fluoroquinolones, the most common being, ciprofloxacin, and two, chiropractic adjustments. So some EDS patients have been floxed, Floxxed. This means they have experienced life-altering side effects from a class of those prescription fluoroquinolone antibiotics, and includes ciprofloxacin, Cipro, Levaquin, and other meds with the name Flox in the prescription name. A rare side effect can occur with ruptures and tears in, most concerning, the body's main blood vessel going into the heart, called the aorta, and that can cause serious, sometimes fatal bleeding. Unfortunately, due to the suspected low diagnosis rate of HEDS, this creates a very large population at risk for complications without even knowing. And it can also tear other tissues, tendons, that sort of thing. But that's the big scary part. So the VEDS Movement website has this article about it, and says, quote, "The FDA's warning indicates that fluoroquinolones, a commonly prescribed class of antibiotics that includes Avelox, Cipro, Factive, Levaquin, and ofloxacin, should not be used in people with certain genetic conditions that are associated with aortic aneurysms and dissections, such as Marfan, Ehlers-Danlos, and the Ehlers-Danlos Syndromes." So from the FDA, which is the United States Federal Drug Administration, fluoroquinolone antibiotics are approved to treat certain bacterial infections and have been used for more than 30 years. They work by killing or stopping the growth of bacteria that can cause illness. Without treatment, some infections can spread and lead to serious health problems. Healthcare professionals should avoid prescribing fluoroquinolone antibiotics to patients who have an aortic aneurysm or who are at risk for an aortic aneurysm, such as patients with peripheral atherosclerotic vascular diseases, hypertension, and certain genetic conditions such as Marfan and the Ehlers-Danlos syndrome, and elderly patients. Prescribed fluoroquinolones to these patients only when no other treatment options are available. And of course, there are other classes of antibiotics, but sometimes certain things are resistant. And so it's okay to question your doctor. And some of us may end up taking a fluoroquinolone because we don't have a choice, but those are choices we want to make that are informed. The FDA also said we have communicated safety information associated with fluoroquinolones in July 2018 and in July 2016. And there were a couple more even previously. The 2018 publication noted significant decreases in blood sugar and mental health side effects. July 2016 is when they first reported the disabling side effects of tears and rips in tendons, muscles, joints, nerves, and the central nervous system. So that could be very life altering and permanently disabling. And I've talked to some of us, and most people that have experienced this did not have a diagnosis to know that their tissue was at risk for these types of tears and ruptures. Another consideration for an appropriate diagnosis that can prevent injury or death is for those of us that seek chiropractic care. And many people that experience symptoms like we do end up seeking chiropractic care, and oftentimes are doing that before they have an actual diagnosis. And there have been multiple cases of what's called a vertebral artery dissection from chiropractic adjustment. So chiropractors, their practice is essentially based in this one type of therapy where they adjust your skeletal system and, quote, realign things. So these adjustments often focus in your areas of pain, and they frequently would adjust people with hypermobility type issues around their neck because we experience so much pain in our spine and our neck. So hypermobile necks can be manipulated unsafely into hyperextension very easily. They can tear these very delicate blood vessels that feed your brain. That's what the vertebral artery dissection is. So those are the two serious, potentially causing death complications. There's other complications, though, and managing cardiovascular health is important for everyone. But the cause of stroke and cardiovascular events in younger and presumably healthier patients can sometimes be attributed to a misdiagnosis. So we recommend you talk to your doctor once you get diagnosed, or even before, as you're going through the process of getting an imaging test called an echocardiogram. And that looks at the blood vessels that we talked about that go around your heart and your internal organs. Some of us are predisposed to a dilation of these larger blood vessels, especially something called the aortic root or the thoracic artery. So the aortic root is the base of that big blood vessel going into your heart, and that can be stretchy. And over time, if it stretches too much, you can be at risk for an aneurysm and tear of this artery because, one, it is stretching out due to the tissue being stretchy. And then because the tissue is fragile, it can tear easily. And so an aneurysm is just this blood clot. And with this tissue being stretched and fragile, it's easier to pop that balloon. So stretchier blood vessels cause minor things. And so there's early signs of us having cardiovascular differences, such as blood pooling in your lower limbs or your hands, abnormal blood pressures and heart rates, complaints of heart palpitations, dizziness. This all plays into the dysautonomias, things like orthostatic hypotension, and POTS. So there's more serious blood vessel dilation, though, can cause those things like aneurysms and rupture and potential death. So other conditions seen with EDS related to your cardiovascular health that can be scary include things like vascular compressions, anemia, and even clotting disorders. In the new research, I found it very interesting that 30% of us experience clotting disorders. And if you paid special attention to the new HEDS gene, that's especially interesting because the HEADS gene that they identified, which I'm sure there will be more, is related to not only hypermobility, but it also is related to blood factors. And so I think that's part of the biological origin of these things. So knowing your specific risk factors comes with a specific diagnosis of your type. And we know statistically certain things are riskier with certain types of connective tissue disorders. So it informs your medical team to know how to prevent complications by prescribing the appropriate things and doing the correct preventative treatments and watching the appropriate labs or the aortic root dilation, that sort of thing. We are learning what the community has been saying since the pandemic also is that we are more affected by some viruses, for example, long COVID. And knowing this can help you get evaluated for symptoms like worsening fatigue and getting POTS managed. And in many cases, of course, hypermobility and EDS is, of course, caused by a genetic mutation. So it's inherited or it's a spontaneous mutation. And a diagnosis will allow you to get genetic counseling for family planning for those at risk of passing on their condition to their children. Some people may see benefit of genetic counseling, some people may not. Also, managing bone health. EDS patients are at higher risk of things like osteoporosis and bone damage, like bone spurs, excessive wear and tear causes essentially damage to our bones, and they build up like scar tissue. Those are those bone spurs. And like Shelli and I have experienced, those lovely little bone spurs start tearing at our soft tissues. We both have torn hip labrums, making it very difficult for us to just walk and used to run. And so earlier intervention and appropriate treatment for our early signs of hip pain, we could have avoided things. So earlier intervention and diagnosis can give us appropriate treatment for things like tendonitis, bursitis, labral tears, etc. These like outcomes of hypermobility over time damaging other soft tissues and bones and joints in your area. Also, a diagnosis can inform appropriate care with local anesthetics and medical procedures. And even dosing of pain medications might be different for us. So you may also end up being diagnosed with a more rare type of connective tissue disorder. And those have special considerations beyond what those of us with hypermobility spectrum or HEADS would consider. So, for example, vascular Ehlers-Danlos Syndromes or VEDS is the inherited connective tissue disorder that causes blood vessels and organs to be very fragile and prone to tearing. So the complications of VEDS can be life-threatening and include aneurysm, dissection and rupture of arteries, and rupture of organs. And if you aren't evaluated by a physician that knows the signs of the rarer types, you may not have genetic testing done to know your true diagnosis and take preventative measures in your care.
Okay, this is a big one for me for a few reasons. The first one is I didn't get diagnosed with a connective tissue disorder until I was 44, even though at my birth, signs were there. Maybe not with my birth as much, but by the time my sister was born 4 years later with a hip out of joint, there were signs that there was something going on. Now, should I have taken up running at the age of 33 because I thought I needed to run off the stress and anxiety I was feeling in my life? No. And if I had known that I had a connective tissue disorder and was crazy hypermobile, especially in my hips, I would not have started doing that, because on Friday of this week, I get to go find out my surgical options for this extremely screwed up right hip I have, because it's severely impacting my quality of life now in a way that I never ever would have imagined in my 30s. Additionally, I did some work with the Department of Defense, and I've taken trips overseas, and I've taken emergency medications, emergency antibiotics, and the ones that they send you over there with are Cipro. So I guess I'm lucky.
I wish the information that we have now was available when I was younger, because the amount of damage that I have unknowingly done to my body, starting as a kid, between participating in dancing for 8 years, playing softball, volleyball, very into sports and things like that. Things where I didn't have to run a whole bunch. Like, I could run in short bursts because I didn't know it at the time, but exercise intolerance, dysautonomia, Also in Florida, heat intolerance was a big factor. So, but in my early 20s, after years of having chronic, horrible leg pain that was just kind of brushed off like growing pains, whatever, I finally had a doctor that listened to me and took me seriously when I started talking about how I was in chronic pain, like especially my left knee, debilitating pain, that I would sublux daily, every day. My kneecap would pop out of place and I'd have to pop it back over. And then grinding, like sounding like dry spaghetti cracking. This is my early 20s. So he took me seriously, did x-rays, did MRI, discovered that my patella was subluxing, jumping off the track because my tibia was misaligned and my ligaments were so stretchy and not holding it in place. So yeah, it was constantly subluxing every single day. He said that I had the knees of like a geriatric 70-year-old in my early 20s. And he was actually very appalled that I had gotten to that point after so many years of bringing it up and not having it be addressed. He was absolutely just incredulous that nobody took me seriously, because all of that damage, we could have prevented most of it had we known. So that's the one amazing benefit of getting your diagnosis, is it's going to help you so much. And the earlier you know, the better.
That was heavy.
Yeah. So the appropriate diagnosis also can prevent unnecessary and expensive tests. Explain.
Right. So aside from just preventing those critical things that can harm EDS patients, it's important to prevent unnecessary medical tests and interventions. If patients and healthcare providers can better understand the underlying condition, we could avoid the frustration and delay of care. So many of us have spent years floundering without a diagnosis or wrong diagnosis, or just barely having symptoms managed and nobody putting the pieces together, nobody connecting the dots. We've endured sometimes invasive or unnecessary tests or treatments that didn't help.
Knowing that you have a connective tissue disorder, especially one that is variable in how it affects your body, is really important in this regard, because going to the emergency room is not fun if you're a chronically ill human. And when I think about the number of x-rays that I had taken for I don't even know how many sprains and strains I had. Imaging is warranted in some cases, but there were some times that I went to my doctor or to urgent care for something that I knew that they were going to say res, ice, compression, elevation. And knowing what I know about my condition now and knowing the comorbid conditions that go along with it, I feel more informed about what tests I really need and what tests I don't. So in the long run, that saves money, because dealing with insurance, that can get dicey at times. Speaking of which, earlier, in the intro, I kind of mentioned that some people may not want a diagnosis on their official insurance record because they think it could negatively impact them. But in my situation, I was able to stop answering certain questionnaires every time I went to physical therapy. Like, I still had to do some questionnaires, but they no longer, it was just a little bit easier. Let's put it that way.
So since my PEDS diagnosis and researching what that entails and all the comorbidities and fun things that come along with it, I started thinking about mostly becoming concerned about other things that I have been diagnosed with, some since my early 20s that I've been undergoing treatment for, that treatments don't seem to work 100%. Like, they help, but it's not, they should be better if that's really what's going on. So with the diagnosis and looking into what that means, like even on like a tissue level and how it affects all the different systems, it's now caused me to kind of go back and talk with some of my doctors and ask about diagnoses that I've had, and kind of re-examine and reevaluate them to see maybe it's not just this, or maybe it's not even that at all, So I think the biggest one, the most recently with the diagnosis, was I was initially diagnosed with fibromyalgia at the start of my journey. And that was a complete surprise, because the fibromyalgia, while I'm not saying I don't have it, but I don't know it's hard to say if it's fibro pain or if it's ED. They're so close, but that was one of the big ones where there's actual like physical things I can do. It's not just fibromyalgia at the very least. So that would be very important to know. And especially with all the other conditions I have, I need to know if that's the case, because going through treatments that I don't need, that can cause more damage than they're helping. So it's incredibly important to get an accurate diagnosis and prevent all of that.
Right. And so the appropriate diagnosis also gives you better tailored approaches to your healthcare.
So one of the interesting things about the hypermobile conditions is that it's not just your joints, right? So if you get a diagnosis, this can actually give you better care in terms of any issue you're dealing with. So there are too many comorbid conditions to really go into detail, but knowing the origin is faulty connective tissue will help you get, to the right diagnosis for these conditions and maybe inform the approach of your other health issues. So part of getting effective care is knowing the correct reason for your symptoms. So let me just read to you an important selection from the medical article by Castori et al. From a framework for the classification of joint hypermobility and related conditions. It was published in the American Journal of Medical Genetics a few years ago in 2017. So the literature is full of case control studies showing a significant association between hypermobility and specific non-joint related disorders. To date, the strongest associations are with anxiety disorders, orthostatic tachycardia, a variety of gastrointestinal disorders, and pelvic and bladder dysfunction. And honestly, we now have data that gives us more informed phenotypes of head specifically. And there's so many comorbid conditions, but there are some particular clusters of conditions, and we call them either the triad or the pentad now. So better guesses when dealing with comorbid conditions give you more accurate and a quicker diagnosis for those other things that are more common with us. Earlier interventions and diagnosis, of course, of those associated conditions are helpful because now you don't have to go on a whole other health odyssey for diagnosis of another issue. So, for example, it's not just anxiety for many of us, and we truly need an evaluation for dysautonomia or neurodivergence. Things more common in us that are not common may switch around our first guesses, such as things like POTS, gastroparesis, or MCAS. So for hypermobile humans with a uterus too, it lends credence to our complaints of awful periods, and we might be taking more seriously to treat excessive or irregular menstruation and be evaluated for things as endometriosis or bleeding disorders. And some of us with histamine issues related to MCAS even develop an acquired hemophilia known as von Willebrand. Ask me how I know. For personal experience. So different approaches for interventions on aspects of your healthcare you may not have considered that your doctors may need to know about, such as mitigating those difficulties with anesthesia or dental procedures, or they may adjust how they dose medications, and your pain responses might be different. And a big part of this better care idea is better pain management. So, for example, EDS patients experience different types of pain, and it might be important for a specialist to be aware of things like the type of pain or that you likely have something called SFN or small fiber neuropathy. And we typically experience two different classifications of pain. And so we need to know what we're treating to manage it. And so there's something called nociceptive pain, which is in response to localized tissue damage. And then there's something called neuroceptive pain, which is chronic and less responsive to treatment. And the idea here is that we can, rather than having this nebulous diagnosis of pain, have a better idea of organically how it's happening, we can manage it better. So we can intervene earlier, diagnose it earlier, get appropriate management of pain, and we can prevent something that a lot of us experience, which are complex pain processing disorders, or at least stave off the onset of these very complex and difficult to treat pain disorders.
You know, before I was diagnosed with Ehlers-Danlos Syndrome and dysautonomia, I went through this awful cycle with my doctors regarding my night sweats. And they were hell-bent on writing it off as hormonal, even though all of my hormone numbers are where they need to be for my age. I'm 47. I'm not really, I have like baby signs of perimenopause, and I'm due for more blood work. So maybe I'm closer than I think. However, it wasn't until I had my appropriate test of a tilt table test, which confirmed not traditional POTS, but an orthostatic intolerance, whereas I can't stand still. I get the blood pooling and all of that. And what was happening to me at night was I was so static then, and my blood pressure would get so low that my body would send me into shock to try to wake me up so that I wouldn't, So those night sweats were a function of my dysautonomia. Now, am I going to get those same night sweats when eventually the change happens? Yes, but, and this is another reason why having an appropriate diagnosis is important, it's likely going to be way worse for me because of the connective tissue disorderness. So, the trick to those night sweats, by the way, I raised the head of my bed only with risers. I think I'm up about 3 inches, just the head of the bed. And that little bit of gravity keeps the blood pumping, which keeps my blood pressure stable, which doesn't send me into shock, which doesn't make me have night sweats.
One of the best things about getting a diagnosis that I found is I have receipts now to back up what I've been telling my doctors for years. So for years, I was told, like even as young as like 11, I was told that when my heart starts going crazy and my chest kind of hurts and I'm just exhausted and tired, I was told that was just anxiety for years, and that was just the surface level. It's not. I have dysautonomia and I also have PVCs. So it wasn't just anxiety. And I mean, I have significant trauma and actual legitimate anxiety surrounding the dentist because nobody listened when I said, I feel everything that you're doing. Because they'd already given me Novocaine and they'd given me, what typically works for people. So that was ignored. And now I have receipts and I can bring in the medical journals or reports or studies and say, hey, here's the data. This is what I have. This is how it affects me. And this is why this doesn't work. So having that, especially from a published, reputable medical source, that's not just the patient, thinking that Dr. Google's telling us what to say, that it's from a medical journal that's been published and peer reviewed by other associates in that field, really lends some credibility. So typically I now send the journal, publication, whatever, that pertains to what we're talking about during the next appointment in advance, and that way they have a chance to review it, and then we can discuss it together at the appointment. Receipts.
Right. And so when you're in a lot of pain, that can mess you up upstairs. So the appropriate diagnosis allows you to better manage your mental health.
Certainly. So mental health considerations should not include only the psycho-emotional impact of our experience, but also the literal biology. So connective tissue disorders affect our nervous system, which affects our ability to regulate our emotions. So Dr. James Costow gave a talk. You can watch it online. We're not going to go through it here, but I really recommend that for additional homework for you. It's titled Being Able to Regulate One's Emotions is the Most Important Thing to Successful Living. And I will link it in the show notes. And the idea is the connection of our emotional regulation and the discussion about how to regulate our nervous system when it's challenged by the things that we experience. Additionally, there's an overlap from both medical literature and our community reporting this that we have a higher incidence of other neurotypes such as ADHD, autism spectrum disorder, dyspraxia, and other things, which if go unsupported and undiagnosed have its own traumas. Also, many of us are diagnosed with just depression and anxiety or both. And a lot of us experience these things being treatment resistant, meaning we've tried multiple medications and interventions and we don't get better. An EDS diagnosis will help you and your doctors understand the physiological origin of dysregulated emotions, and then we can target treatment better. So is your anxiety related to emotional dysregulation and pain? Many of us experience a lack of feeling what we call body safety. So we're constantly in an aroused state in our nervous system, like fight or flight, those trauma type responses. So that high alertfulness can trigger these, what outwardly may seem like mental health issues, but it's coming from a very organic biological origin, and no amount of antidepressant medication is going to help with that. It's not a serotonin issue. So things like mindfulness intervention and body safety and somatic type therapies have been shown to help people like us because it's really addressing more of the autonomic dysfunctions that in conjunction with appropriate medical care for these causes, the pain, empathy pots, that sort of thing. Or even MCAS, by the way. Also for consideration is appropriate treatment of these things prevents self-medicating with things like opioids, alcohol, or street drugs that obviously have their own serious ramifications.
You want to know what really went away once I got an appropriate diagnosis? A lot of my anxiety and depression. Now, don't get me wrong, I have moments, for sure, but I can see where and when the anxiety or depression is going to happen now. Like, I know why it's going to happen. And that is huge for my mental well-being. Additionally, the ADHD diagnosis saved my life. Literally. That's a semicolon. For years, I always said it was for other people I supported because their lives matter. And I don't want anyone to die by their own hand. Unless they're a terminal patient and it's their choice. That's a different conversation. And I was always too ashamed to talk about that because 2020 wasn't the first time that it had crossed my mind. And it wasn't even that it was like a depression necessarily. It was that I just always hurt and I didn't know why. At least now I know why. And at least now I know why a lot of my people who I thought were friends aren't my friends. Or never were. But that's a different episode. That's the traumatism episode. The appropriate diagnosis can help you gain access to support services if they're available.
So a diagnosis can make individuals eligible for support services and accommodations at school or work, ensuring that we can function to the best of our abilities. In the US, school children may benefit from things called 504 plans or IEPs. You might be able to access disability coverage from government programs, federally or through states.
Strictly speaking, from an ADHD perspective and as a parent of 2 ADHD kiddos, having a formal diagnosis was very, very important. Now that's strictly speaking neurotype wise. As far as Ehlers-Danlos goes, my youngest does not have an official Ehlers-Danlos diagnosis yet. We're working on it. And originally they weren't going to be living on campus because it's only 30 minutes away, but given the program that they're in and the benefits of working in a collaborative environment in the art studio, they're going to live on campus. And what that means is that they need some accommodations. And I don't have the EDS diagnosis for them yet, but I do have an ADHD diagnosis, which is going to be really helpful in obtaining services while we're in pursuit of additional diagnoses. And honestly, I think at this point, given their symptoms, we're going to skip the looking for the EDS diagnosis and go straight to the dysautonomia, because we don't need, even though I have their genetics, we don't need genetics for that. You can ask them to go walk around the block and watch what happens. That's all they need to do for that. So,
with the diagnosis of HEDS, it's for right now, it's not, as far as support services go, not beneficial to me in that regard. It is for my children. So with their diagnosis, we are able to get 504 plans, and it's very comforting to me, and it makes my heart so happy to know that they have protections in place that I didn't have when I was little, and they're not going to have to go through the same difficulties with their bodies or their mental health as I did when I was younger. So that has been a huge win for diagnosis.
An appropriate diagnosis can open the door to finding community and peer support.
So one of the greatest gifts to me of diagnosis and putting the pieces together was finding my community. A formal diagnosis can connect individuals with EDS or HEADS or other conditions to support groups and communities where they can share experiences, coping strategies, and emotional support and resources. So there are online communities, or even sometimes in-person support groups. Other disorders have specific support groups and foundations that are particular to specific conditions. So the Marfan Foundation obviously supports Marfan syndrome patients, but they also have subsections and support other inherited disorders of connective tissue, including LDS, Loeys-Dietz, VEDS, KEDS, Stickler syndrome, Beal syndrome, bicuspid aortic valve, ectopia lentis, familial aortic aneurysm and dissection, the MAS phenotype, and Sprinson-Goldberg syndrome. Stickler also has SIP, which is Stickler-involved people, and those with the familial aortic aneurysm and dissection and TAAs can get involved with the Ritter Foundation. And there are links to those 3 additional foundations in our show notes. We often reference the EDS Society. They want you to be aware if you are diagnosed with a different type of connective tissue disorder. There are resources there as well. And I would recommend you check marfan.org out, as well as the Ritter rules, because those have great resources that apply to hypermobile humans just as a whole.
Hi, this podcast is brought to you by An Appropriate Diagnosis. Have a good day.
Without sounding too hyperbolic, finding my people has been life-saving for me. I'm going to get sappy for a little second. When I first came across Luna and Shelli and the podcast, as well as other advocates and the other Zebra community members on various social media platforms, I was at a pretty difficult point in life. I think it was like year 1 of COVID lockdowns, and I was so sick from the health issues and health struggles that I was having, and trying to find answers for that. I was just exhausted on every level possible, as so many of us were during that time. So finding the community, finding people that were going through something very similar to what I was going through, that had the same experiences, that, their bodies did things that mine did that I always thought was normal or typical, and finding out it wasn't. And that was very eye-opening, as well as other emotional experiences that very closely mirrored my own. That was amazing. That was a huge help. And being able to talk with other people, particularly with the same conditions, was just the most helpful thing that I could have done for myself. And even therapy wasn't doing anything, really. I was in for 3 years. I didn't see anything, any progress, until the diagnosis came and everything else started falling into place. That is when my mental health just started blossoming again. So finding that community and support, especially when it's something that's invisible a lot of the times, where people don't see it, and don't understand the nature of a dynamic disability where one day you can be fine, but the next day you can't walk. Having that doubt from the outside world, and then you start doubting yourself, but finding the people that are going through the same thing and saying, you're valid. That's what I go through, and it's the same. And that's been amazing.
The appropriate diagnosis can expand research and clinical trials. And many of us are reeling, like you mentioned earlier, about the prelim findings of the HEDS gene. And so thank you, everybody who took part in that.
And also, for me, the big thing I get out of that is that gene was only in a small group of people within this very large data set. So I'm sure there will be more genes. So your participation and diagnosis puts you on the map for things like participating in research, but also just statistical analysis. A lot of the research studies that are going into propelling our care and understanding of these conditions aren't things like individual case studies or family studies. It's large aggregate data research. So if you have a diagnosis, all of a sudden you're in the data pool and they're gonna see you. You get counted. So participation in research studies and clinical trials can help advance our understanding of these conditions and potentially lead to better treatments in the future. There is strength in numbers, and with a better understanding of our disorder and hypermobility as a whole, we can have louder voices to propel research and treatment exploration for all of the hypermobile conditions. The community, of course, had that big success with the HEDS gene, but also even more important is the clinical application of understanding our conditions and creating approaches for doctors to help treat us. So we had a big success with a clinical guideline finally being published. It's the first one. It's the first protocol for care for hypermobile EDS, and it is actually in reference to those of us that have uteruses. So the title is Management of Childbearing with Hypermobile Ehlers-Danlos Syndrome and Hypermobility Spectrum Disorders. Also, there's some new research coming out about other treatment options with LDN that has gained some momentum. And I've said in the past, like I'm scared to try treatment for something where we haven't looked at how it affects our condition. And now we're looking at these things a little bit better. So in March of this year, a research study was published on the effective doses of low-dose naltrexone, LDN, for chronic pain. Also, influence over better understanding of our disorder helps build better training for our medical providers. So, for example, the EDS Society has the EDS Echo Series, and it has been growing as awareness and funding has grown. But evidence-based research doesn't exist without data. Coming up with ways to treat patients and the platform to share that treatment and actually having protocols for training providers and educating them both in their original medical school training and in ongoing continuing education wouldn't happen if we didn't continue to push and advocate for this. So if you are diagnosed, not only do you get counted in the statistics, or you might be considered for things like research, but then that builds the snowball of things like treatment and education.
You know how it seems like every day we're getting new information or new studies are released on the treatment, diagnostics, et cetera, of all of these related conditions and or autism spectrum disorder and other neurodiversities. People in studies did that. People getting appropriate diagnoses did that. People talking about it did that. All of these things play a role in gaining more knowledge.
The appropriate diagnosis can be healing emotionally.
Certainly. So getting diagnosed won't cure you. But the diagnosis can provide validation for individuals who have been experiencing unexplained symptoms for years, helping them understand the root cause of their health issues. And many of us express that finding a reason can be encouraging and motivating. I enjoy hearing from followers when they tell me they're finally diagnosed. They express a wide variety of emotions, but most often people have expressed to me feelings that align with the stages of grief, or they report a deep feeling of emotional release and validation after that initial shock wears off. Healing these traumas allows for something called post-traumatic growth, which means after you see the other side of going through severe trauma, something in your heart heals, and people who've gone through traumatic things experience rapid, big growth, opening the space in your life physically and emotionally for things that fulfill you, not just trying to get help for your health conditions. Unmasking disability and autism is much more arduous the longer we go without diagnosis and support. Diagnosis really just begins the stage of grief and allows this emotional healing and integration of our full self.
The appropriate diagnosis can allow us to better manage the financial burden of our conditions.
So the expense of disability is difficult enough as it is. The financial costs can negatively impact our care and life, and throwing money at the wrong treatments or things that aren't helpful can be very discouraging. This can impact healthcare costs outside of just you and your family too. Things like healthcare costs associated with your insurance plan, your community, and healthcare costs in general impact your whole community. So studies on healthcare costs suggest we waste in the United States over $1 billion a year on this diagnosis. Imagine if we had those funds appropriately managed.
It's hard to imagine that, actually.
Hi. So, with regards to your expenses when it comes to an appropriate diagnosis, this kind of ties everything together that we mentioned before, and that's you won't be wasting your time on tests. You might not be changing doctors all of the time and going in with new startup fees. You might decide that you don't necessarily need to pay $3,000 out of pocket for XYZ test. That maybe doesn't seem quite so important once you have a better idea of what you're dealing with, right? Additionally, even though you can save money, theoretically, hypothetically, hopefully, when you get a diagnosis, because there is so much, right now we're like in an information, like the information is coming at us fast and furious. And I don't know about you, but sometimes I'll like hyper focus on something and then I get like overwhelmed and then I just go hang out in the corner for a while. And when I first got diagnosed, I started buying every support, supplement, brace, special leggings. I mean, if it could be marketed to someone who had been looking for answers for as long as I had been looking, I was likely going to buy it. So people who are interested in making money over helping people, that is not to say that people can't make money and help people. I'm talking about like preying tactics where they like pounce on you and be like, you need these supplements, or you need this, or if you take these supplements for these conditions that we have definitively determined with the prelim hedge results aren't the cause of heads. See where I'm going with this? Now, I also, in addition to having all of these problems, I am prone to certain vitamin deficiencies. But over the years, now that I know that I have all of these things, I've kind of gone back and looked at blood work when I had deficiencies, and then I was able to see a pattern. And regular supplementation or just making small changes in my diet have fixed some of those issues.
So the appropriate diagnosis can leave a lasting legacy and impact on the community.
So medicalized trauma affects an individual, but the elephant in the room with our zebras is there is generational trauma that occurs with an inherited disorder going undiagnosed for years and generations, because it affects so many aspects of our health and psycho-emotional experience as we go undersupported and undiagnosed, and we pass these traumas on to our children and so on. On a basic level, your diagnosis establishes a family history. So in medical terms, that family history establishes something for your children or the other people in your family. So the next generation is more empowered to have a better quality of life as they make more informed life choices and navigate life with a disability and make informed choices with their healthcare. But on a deeper level, this impacts our relationships and our place in the world. As we mentioned earlier, this condition affects our nervous system and our ability to emotionally regulate. So this informs our ability to connect with other humans, which obviously impacts everything from our family life, romantic relationships, friendships, spiritual relationships, community groups, your work, your employment. If you're not familiar with attachment theory, it is the idea that what we experience as children as we develop with our caregivers deeply informs how we relate to other people as we go out into the world and grow through life. There are things called ACEs, or adverse childhood experiences, that can alter the way we respond emotionally and physiologically, and those have been studied in depth. Having parents that have unmanaged disability or unsupported neurotypes, such as unmanaged or undiagnosed autism or ADHD, can cause unmet needs for their children, such as having a caretaker that isn't emotionally available because they are ill or emotionally dysregulated or hospitalized or inappropriately medicated or self-medicating. Or the child must take on adult responsibilities, or the child must face adult situations at too young of an age. So these adverse experiences teach a child to find ways to cope with these adverse events. And over time, they become a pattern, and it could cause recurring long-term complex trauma. So attachment issues affect our family systems, how we interact with our family, and that informs our other interactions as we become an adult. These attachment issues within your young family can cause something called insecure attachment. And that can be compounded by the biological nature of neurodiverse conditions, such as ADHD and autism spectrum disorder, to experience insecure attachment. Sometimes you'll hear it as anxious or avoidant, fearful avoidant, disorganized. All of those fall under this category of insecure attachment, where we do not attach well to our caregivers or to other people in our life later, and we resort to unhealthy coping skills. So as this trauma perpetuates, when that child inherits this condition, and then when they seek support, they don't have a caregiver equipped to help because everyone is undiagnosed. This cycle passes on to one generation to the next until someone recognizes it and overcomes the pattern to find enough resources to begin to heal those generational traumas. And the person that identifies it and begins the healing doesn't finish it, because it's a journey, again, down through the descendants. So we will have an upcoming episode on this topic of trauma, because I think it's one of the most important lessons, but it's certainly not an easy fix. It's not a hack. We talk about hacking hypermobility. This isn't just an overnight, easy, do this thing, but it is probably the most important work that we can do. So developing children need some very specific things. A caregiver that is emotionally and physically safe most of the time. And with a diagnosis and with support and with appropriate care, you have the space to love those people in your family more fully. A child needs to feel worthy. They need to feel loved. We begin to collapse inward and feel a sense of maybe unworthiness if we feel we can't keep up with our peers, or if we're an inconvenience within our family. A child needs to grow into their whole self, and many of us don't get this opportunity if we grow up in this type of environment. We, as children, need to feel empowered to face any of these differences, whether it be our physical disabilities or any other life challenge. A child with the adverse child event, or ACE, of an undiagnosed parent may struggle with connecting emotionally to others, and this will affect their ability as they go through life and the physical disability challenges of having things like EDS, because we may struggle with seeking help medically or otherwise. We may be overly independent or attract partners that we overly caretake, because that was our pattern with our family, thus exhausting our precious energy. We may spend much of our time being overly defensive because we're in fight or flight. We may struggle to emotionally regulate through conflict or normal life challenges, let alone the rigors of a chronic illness. And we may struggle to trust others, and so we may avoid seeking healthcare or community support. So diagnosis truly means family and community impact. Standing up for yourself, bringing awareness to your disability, brings awareness to the community as well. So this extends beyond just one person, beyond just you. Your journey can help inform your doctors and your family. Diagnosis is disability activism.
To be continued next week.